Hello all, my name is Kendra Cobb. I'm going to be presenting the advocacy efforts focusing on the LGBTQIA plus community. This presentation is going to be an accumulation of work throughout this course where I've explored the population's needs, developed an advocacy plan, created a social media campaign, and also conducted a survey research. I will also discuss lessons learned, barriers encountered, and how advocacy efforts can be evaluated using concepts from our text, The Advocacy Practice for Social Justice by Richard Hofer, and also three-cited sources, excuse me. So first, this is my agenda. So the population overview, challenges faced, resilience factors, historical marginalization, societal context, social policy impact, advocacy efforts and plan, survey questions and administration, survey results and community needs, along with evaluating the advocacy efforts, lessons learned and barriers, and also my references. So first we have our population overview. So within the LGBTQIA plus community are individuals with diverse sexual orientations, gender identities such as lesbian, gay, bisexual, transgender, queer, intersex, and asexual plus individuals. So this represents diverse identities across genders, sexuality, race, and socioeconomic statuses. So the aspects are strongly emphasized on identity, expression, acceptance, and community support. Many individuals rely on chosen families, especially when biological family support is limited. And so advocacy and activism are also deeply embedded in cultural values due to a long history of marginalization. So challenges that are faced, so we have discrimination in housing, employment, and healthcare. Fraser et al. 2019 article focuses on the increased rates of homelessness, especially within the LGBTQIA plus youth community. There are mental health disparities, higher rates of depression and anxiety within this marginalized group of individuals, limited access to affirming providers, social stigma and rejection from family and friends also. These challenges are on a systemic inequality level. Some resiliency factors. There's a strong peer support and chosen family group systems, community-based organizations and advocacy groups, identity pride and empowerment, increased representation and visibility, access to safe and affirming spaces. Hagler et al. In 2025 article emphasizes the resilience and how it helps individuals within this marginalized group to cope despite the structural barriers and discrimination faced. The historical marginalization. So historically, LGBTQIA plus individuals have faced criminalization, systemic oppression ongoing, laws once prohibiting same-sex relationships, and many individuals were stigmatized and institutionalized because of their choice of sex differences. A major turning point within the LGBTQ community was the Stonewall riots that sparked the rights movements within the LGBTQIA plus individual and groups. The HIV and AIDS crisis in the 1980s further highlighted disparities as the community faced both public and health emergency and widespread discrimination overall. So understanding the history is very essential and important to help explain the current disparities and the mistrust within institutions and what individuals within this marginalized group have faced. The current societal context. So Today, there have still been, significant advancements within the LGBTQIA rights movements, including increased visibility and legal representations and protections, improving, and to be more consistent. Continued discrimination and policy debates, they're ongoing, and increased overall awareness, and just the ongoing inequality that are still persistent today. But these ongoing debates, and while society is still becoming more accepting overall, there still are advocacy efforts that are being presented and are ongoing. Social policies impacting the population. So at the federal level, we have policies such as the Obergefell and the Hodges legalized same-sex marriage, representing a major milestone within the LGBTQIA plus community. Federal, the anti-discrimination protections that have also expanded in some areas. And the employment and healthcare as well. On the state level, protections across the board are very significant. Some states have strong anti-discrimination laws, while others have limited or restrictive policies. So some, those are still, per state. And then on the local levels, policies such as non-discrimination ordinances and LGBTQIA plus programs can directly impact the overall access and services available within the community for individuals that are in or local that are part of the LGBTQIA plus groups. So these differences impact the overall access to resources and safety overall. So the advocacy plan, for my advocacy plan, focused on addressing first the LGBTQIA plus youth and homelessness and just the overall social justice. And so the goal, but my goal of understanding, it was, important for me to identify what research was needed, and so that I can see what is disproportionately affecting, individuals within this group. And so, the goal in identifying access to safe housing, affordable housing, and safe environments. So within this, strategies include, forming partnerships, community organization, where bringing awareness, just outreach and just advocating for policy change and connecting youth to services. And, those strategies, the ongoing, we're there as a unified model approach to adequately address the problems overall. And so with that, also, there was a social media campaign that I saw that it is important in within this course, being able to identify different platforms where we can bring social awareness. I was able to bring awareness and engage in community and advocacy efforts on that level, utilizing YouTube, Facebook, YouTube, Instagram, there's also other ones out there, Facebook. And so the purpose, again, to raise awareness and mobilize the community. Content examples, I was sharing, just the overall homelessness, social discrimination, family isolation, resource guides, limited access to resources within the community. And just using the hashtag safe housing for all, hashtag LGBTQ support, and hashtag safe space for all. So all these are various hashtags that are used. And for my advocacy on my social media, I used hashtag safe space for all. And the outcome, just increased engagement and the overall community awareness within this marginalized group of individuals. And so the survey questions and administration, so sample questions that I provided were in my survey were what are the most important issues currently affecting you? How accessible are LGBTQIA plus affirming healthcare services in your community? What changes would you like to see in your community to better support LGBTQIA plus individuals. And so my administration plan was an anonymous online survey, so Google Forms, distributed through social media, community partners, students, families, friends, and the target population, of course, was LGBTQIA plus youth and other groups that may be associated or maybe just indirectly involved or just wanting to gain understanding as to what their knowledge is. So the survey results and community needs identified after the advocacy plan and the survey data collection. So key findings: high need for mental health services. There's a lack of safe and affordable housing. The need for inclusive community spaces. And community needs identified were affirming services, increased access to housing, and support networks. Evaluating the advocacy based on the text within our course, the advocacy from Hofer 2019 Advocacy Practice for Social Work Justice. Evaluation methods: tracking engagement through social media and participation, measuring outcomes, policy changes, surface access, collecting feedback from the participants, getting their firsthand perspectives of what their specific needs are, and then just that ongoing monitoring to adjust strategies as needed to make sure that we're really able as social workers to capture what the intricate needs are of our marginalized groups in hopes to remove oppression and discrimination and just improve the overall health and the well-being of our clients and communities that we serve. Lessons learned and barriers throughout this process. I learned the importance of centering the voices of the community. Advocating is the most effective, important part of being a social worker and advocating because it reflects the live experiences, the need for being culturally competent those culturally competent approaches, and then valuing the collaboration. And so barriers, low survey response rates, obviously of the targeted population. Time limitations, obviously, we're in the course, so it doesn't always allow for the most amount of time to capture all the data and get the targeted population. And some barriers were also, trust and privacy concerns. Limited funding resources, really being able to push the survey and data collection out there and being able to capture that. And so these are my references for my PowerPoint presentation. And I just want to say thank you so much.